Hi, everybody. Welcome to my final project presentation. My final project deals with PTSD in American veterans. So firstly, what is PTSD? Post-traumatic stress disorder, or PTSD, is one of the most prevalent mental illnesses within the American population today. PTSD is a disorder that individuals may develop after going through a traumatic or shocking experience. It is estimated that 7.7 million adults in the US suffer from PTSD, which is roughly 3.5% of the population. Symptoms of PTSD include vivid flashbacks, intense nightmares, insomnia, lack of emotion, and a constant feeling of being on edge. While physical symptoms include frequent sweating, high blood pressure, high heart rate, along with being startled easily. PTSD in the military. PTSD is especially pervasive among former military personnel. The percentage of veterans dealing with PTSD varies depending on which war they served in, however. 11 to 20% of those who served in Iraq reported PTSD in a given year, while 12% of Gulf War veterans reported PTSD in a given year. And 30% of all Vietnam War veterans will suffer from PTSD at some point in their lives. These rates vary due to several factors, including but not limited to what type of war was fought, what type of enemy was faced, the politics around the war, etc. For example, combating against guerrilla warfare, like the style of combat utilized by the Viet Cong, is extremely anxiety-inducing and stressful compared to more conventional forms of warfare, and can lead to higher rates of PTSD as seen with Vietnam veterans. Or the politics around a war, like the Vietnam War yet again, can also increase the likelihood and severity of PTSD. PTSD in women in the military. As of 2015, almost 10% of the veteran population were women, which is roughly 2 million women in total. The most common form of PTSD among female veterans is MST, or military sexual trauma. MST is sexual harassment or assault that occurs in the military and leaves a lasting impact on someone in the same manner as PTSD. 23% of female military personnel reported sexual assault, while 55% reported sexual harassment. Only 38% of male military personnel reported sexual harassment in comparison. If you look to the figure on your right, the chart shows the percentage of PTSD issues granted for MST and non-MST related claims. If you look to the year of 2011, you'll see that a much higher percentage of PTSD issues were granted for non-MST related cases in comparison to MST related. But as the years go by, this disparity has almost vanished between issues granted for non-MST related cases and MST related cases, thanks to efforts put forth by the VA. The societal impacts of PTSD. Employment rates for veterans are already comparatively low in regards to the rest of the population, and this rate is even lower for veterans with PTSD. Veterans and others suffering from PTSD are also more prone to violence, and this includes domestic violence, as Vietnam veterans have much higher rates of spousal and child abuse. The suicide rates for afflicted veterans are much higher than the rest of the populace too. 30 out of every 100,000 veterans will commit suicide, whereas the civilian rate is only 14 out of every 100,000 in comparison. If you look to the figure on your right, you can see veteran suicide rates in comparison to U.S. civilian suicide rates. And while U.S. civilian suicide rates have steadily increased since 2001, whereas veteran suicide rates have stayed somewhat steady, veteran suicides still account for a very large portion of all suicides in the United States. So where is the discussion about PTSD? As shown throughout the presentation, PTSD is a widespread issue that seriously damages our veterans and our fellow civilians. So why do we hardly see anyone talking about it? Well, for one, most veterans are not very open about it in the first place, even among other veterans. Many veterans who are dealing with PTSD have feelings of insecurity that go along with it too. Secondly, the issue is not taken serious by many individuals. This is either due to a lack of knowledge on the issue of PTSD or a lack of concern because the issue does not pertain to themselves or their loved ones. And lastly, PTSD can be a very sensitive topic. It can be difficult to discuss with someone who has had PTSD or is currently going through it. And lastly, treatments and recovery for PTSD. There are actually several treatments and support groups available to those dealing with the effects of post-traumatic stress disorder. These include medications and therapy options that have proven to be incredibly effective at treating PTSD. There are also countless veteran support groups across the country, but unfortunately, connecting veterans with these treatments can prove to be difficult. Professional help is also available and strongly recommended, especially for veterans whose experiences are likely more traumatic than most other civilians who also suffer from PTSD. But thankfully, recovery from PTSD is fully possible. It just requires time and a lot of work. Thank you.